Stress.
Stress.
Stress. I'm having trouble sleeping.
I was really sick.
It's ubiquitous.
I can't cope.
I'm having trouble focusing.
Stress is a real living problem in your life, and if you don't recognize it, manage it, you're going to get sick.
Stress. Independent of how we define it, we are all impacted by it. In fact, it is well understood that workplace stress is as bad for the heart as smoking and high cholesterol. Today I'm honored to be joined by Dr. Kevin Fleming. Dr. Kevin Fleming is trained in neuropsychology. He is an executive consultant, and he is the CEO of Gray Matters International. Dr. Fleming today is going to talk to us about just what stress may be, some of its possible causes, and offer us some new insight and perspective on how we may manage stress. Dr. Fleming.
Thanks, Tony. Good to be here. Yeah. Stress, right? We know that word quite well in our day. We probably use it tons and tons. So right now I want to put you guys to the test with your knowledge of stress. Get a picture of someone right now in your brain, a man or woman who is stressed, and tell me some words to describe that person right now.
They look drained.
Drained. Good one.
Impatient.
Yeah.
Jaws clenched.
Sweating.
Sweating.
Frustrated.
Frustrated.
Worried.
Worried, yeah.
They have a lot going on in their head.
Mm-hmm. Yeah, you guys are nailing this. This is really, I think, the common picture of stress when you try to define it. The common denominator that you guys all share there is that it's physiological. You guys give a lot of words about what goes on with the body, how it shows itself on the face, right, or in the gut or wherever. This is partly true, about a third true. What I'm going to share with you right now is what we call more the clinical scientific definition of it. The three factors of stress are as follows. Has to have physiological arousal for some activity to be coined as stressful. And you guys nailed it. You guys picked up a lot of signs of the body when it's aroused, right? Okay. The second one is that it's deemed aversive by us. So if we actually had the choice, we would turn down the knob a little bit on severity or completely avoid it altogether. And that's sort of your way of checking out if something you're involved in is aversive. So in other words, somebody may go skydiving and have arousal, but not find it quite aversive to them. They have the adrenaline flowing, they got the cortisol kicking in, but they find it lovely and joyful. Okay. The third piece is, do you have a perceived sense of lack of control over that? So you put those three together, arousal, aversive, and a sense of a lack of control, and you've got yourself a perfect storm for something very interesting to happen in the mind and body. What is that interesting thing? Well, it's a blurring, it's a confusion of an acute stressor. Someone slaps you in the face, you get a mosquito bite, or someone cuts you off on the road, whatever. Those are acute, stressful events. It confuses that with what we call chronic stress. What happens is something acute moves silently and sneakily into this realm of chronic stress. The real culprit for this confusion is resting in that 3-pound organ in your head, on your shoulders, the brain. The brain wants to be right. It doesn't want you to really be stress-relieving in your decision-making. It loves patterns. Right? It just loves what it knows right now and grows that, okay? And so that's something to really keep an eye on, because that is a deception piece of the brain that becomes kind of normalized for us. So I'm going to tell you about a little study that will put a picture right in your head about what really chronic stress is. There's a guy named Marty Seligman at the University of Pennsylvania. He's a psychologist, and he was doing an experiment on rats. Go figure. And he had some rats in this cage. And it was divided by this barrier. And they had put these rats on one side, and a little barrier. It wasn't a complete closure, so they had enough room to go over the fence, over the barrier, right? But they put these rats in one side or one half of the cage, and then he started randomly shocking these rats. But there was no pattern to the shocks. They were very random. You couldn't predict if it was going to happen here, here, here. So you basically had this sort of crazy nature of these rats dancing around trying to avoid the shocks. Well, something was fascinating after a while. The more they were doing that, the more the rats just actually stayed on one panel and didn't even move, even though they were glancing over their freedom over the fence, so to speak, right? They were staying put on one panel. This was fascinating. So Seligman realized that these rats were learning helplessness because of the loss of control piece that they were feeling. They could not predict the pattern. Tell me, does that sound like your work life at times? People feel that? Go left. No, go right. Now go straight. Now go back. Turn around. Now touch your head. Turn right. Whatever. You have a lot of patterns you're trying to decipher. The trick with stress and why learned helplessness becomes really the big picture of what stress is the brain loves patterns. even if the pattern is to just decrease energy, increase efficiency, and stay put. That's why those rats were doing that, right? It was just going on automatic pilot, survival mode. It's too much energy to try to solve it. We are like that at times, and we have chronic pressures coming at us. So learned helplessness is very interesting from a psychological perspective because it disconnects us from truth. It disconnects us from reality. So with this learned helplessness part of us, what happens is we disconnect from ourselves, we disconnect from others, and ultimately from what's real. That's the toughest part about this, and we end up getting very diluted. So what happens? Well, I'm going to give you some stats of what actually happens. Just last year, 550 million workdays. Now, that's just an estimate. I'm sure were lost due to workplace chronic stress. 550 million days of absenteeism were related to this. Another fact, 80% of doctor visits are actually related to stress. The other piece, 1 out of every 2 employees in a workplace these days are actively or passively looking. In other words, if you plopped a job offer right in your cubicle that was better than what you got, most people would jump, or at least half of the folks. Okay, that's pretty interesting, especially when you link that desire to leave to a burnout statistic of about 70% of people. That's amazing. So really what we got here is we've got a very grim situation with stress that is more than just, I'm stressed, which is such a common word now. I think we use that as sort of like, yeah, me too. But there's a real underlying dynamic here, folks, that is bordering on reality testing problems, right, related to it. So we really got to do something about it. And so the main points today that we'll be talking about with stress is that there are a lot of things we can do, but you cannot do those things until you understand what's going on in here. So we're going to talk about some brain tips of how you get your brain comfortable to change even before you do a stress management tip or an idea. The brain has to be woken up. So that's what we're going to talk about today.